Um, Thank you. And just a quick mention regarding the STARS project update. We continue to work with the vendor on testing and working on data conversion. So we're just continuing to do that step in the process. And so um, just to let you know, that's as exciting as it is right now with regards to that. But we do want to make sure for you to review the employer training schedule that's available on the STARS webpage. So training will be in February and March. Recordings will be available for viewing of each of those sessions, and materials will be available on the webpage also for reference. But we highly recommend attending the trainings where you can listen to Harold and I live and in person. The next thing we're going to go into is the um, health insurance information. So now I am going to share my screen. Okay, thank you. So we're still in testing regarding the health insurance portion of ESS. So I did not want to run into issues throughout the demonstration that would hinder a complete view of those steps. So should we be in a better position next month? And if time permits, we can coordinate a demonstration next month when we are scheduled to do the member services review also. So today, right now, I've got on my screen the spec document regarding the health insurance. So the purpose of the health insurance import is in STARS, employer self-service, is to notify public safety of a retiree enrollment in an employer-administered health insurance plan for the appropriate pension deductions and subsidy to be calculated. The information provided by the employer focuses on the retiree choice of insurance or enrollment elections and dependents. And this includes new enrollees, existing enrollee election changes, dependent changes, and updates to the employer administered insurance, which could include premium changes. There are two methods for reporting health insurance enrollment record changes, additions and deletions. So you got manually. The employer updates one retiree record at a time in STARS employer self-service area, or importing, uploading an Excel file in the STARS employer self-service area. Employers may choose to submit an annual file when there is significant changes, adds, changes, or deletions for open enrollment or premium changes. Some employers may want to submit a file every month. And files update a retiree record, not the employer record. So if a retiree is not on the file, the retiree record will remain unchanged until the record is changed manually or by uploading a file. So this means if the employer submits a file only for retirees that are in your records for processing subsidy, know that a retiree record will remain active with public safety until the file reflects a change or a termination of coverage or a manual change to the retiree record is processed by the employer. Employers may need to report manually or with a file upload any changes, new enrollments, or terminations every subsidy period, and where there is a change in plan coverage. Some of the format and file details. So on the spec document, this is where I took this information from. The format for the imported file is excel.xlsx only. The date format does include a leading zero where applicable and does not include any characters or breaks between the day, year, and month, day, and year reported. The Social Security format is 9 digits. So to ensure the format works, update the cell to text so that the leading zero populates. Premium amounts. The premium amounts format must be 9 digits, which could include leading zeros. The last 2 digits in the premium amount is the cents, and there's no decimal point in that information. The tools available are on the STARS webpage and include the health insurance import file or the file specification document, which is what is on the screen right now, and the health insurance field values example. Both are important reference tools when building the import file. I'm going to switch to the field values example. So again, this is a good resource. I just highlight a couple pieces on this information. This is the first of 3 parts. I need to get to the right tab here. There we go. There we go. So the first line of data, the first of 3 parts of data needed for the import file. The file begins with the primary enrollee information or the retiree information. This is the transaction code R1. The enrollee is a retiree who returned to work for an employer of the plan, or a retiree who is enrolled in COBRA. The data includes identifying information such as the retiree name, retiree social security number, a date of action or event date, and the retiree date of birth. The second of 3 parts of information needed for the import file. This is the health plan information section. This line of data is transaction code is 03, and the employer provides health insurance enrollment information and can include medical, dental, vision, and/or pharmacy. The data for this section begins with a retiree SSN. This is important information as this identifies the retiree in STARS so that the health plan information gets to the correct retiree. From there, the employer will provide details of the retiree elections for medical, dental, vision, and/or pharmacy, single or family, Medicare or no Medicare, whether it is the pension deduct, an employer plan code, which is an employer-derived code, plan group, such as COBRA, retiree, return to work, coverage effective date, or coverage stop date. So there's important information that needs to be included in this line regarding the retiree's choices. The third of 3 parts needed for the import file. This third part of information is the dependent information. This transaction code is 06. The employer is providing the retiree's dependent information and other required information about the retiree's enrollment. Again, this line of data begins with the retiree social security number, like the prior 2 parts, the primary retiree, the enrollee or retiree, and the health plan information. This will link the information to the correct retiree. New information is the dependent social security number, date of birth, gender, and gender code. If reporting a dependent, then the information is required. The employer will need to indicate which coverage the dependents will have: medical, dental, vision, and/or pharmacy, and the coverage effective date. The other, and as part of the dependent or O6 transaction code, is the Medicare indicator. This report, the health insurance field values example, has the information about what each of the codes are for the Medicare indicator. And remember that the retiree is a dependent and will need to be added under the dependent information transaction code 06. Data conversion when the launch occurs, data conversion will include the current health insurance information that we have on record for the retiree. So the information will carry over. However, if there are any new enrollments or changes effective April of 2026, the employer will need to report the new enrollments or changes to the retiree records in STAR's employer self-service area. And where the employer would usually report premium changes to our office by providing public safety with the new rates or completing the ER subform for new enrollees and termination of coverage, updates such as these will be completed by the employer in STARS through the employer self-service area. And that concludes the review of the health insurance information. And again, the information that I had on my screen is available on the STARS web page. At the very bottom of the page, there are resources listed there, including these two documents. So I'm going to stop sharing. And just to remind everybody that the monthly meetings are on the third Wednesday of each month, at least through May of 2026. The next meeting will be Wednesday, February 18th at 1 p.m. And the demonstration will be the member self-service review for employers. And we will see what we can provide regarding the health insurance view also in ESS. So thank you. Are there any questions that we can help with today?
Joann, I'm checking the chat and I'm not seeing any questions coming through at the moment.
Okay. Again, make sure to check the webpage, the STARS webpage for the scheduled training for February and March. Again, you don't want to miss listening to Harold and I live as we do our presentations. But there will be recordings of each of the presentations and materials to view also. All right. If you have any other questions that you think of after this, you can certainly reach out to Harold or myself. And that is it for today. So if there are
Joann,
no, yes.
where can we find the information? There was mention of additional training, employer training for like our payroll team and whatnot. Do you have those dates out there yet for when that training will be available? I know it just said check back in early spring at that time.
Right. And on the STARS webpage, when there is a link to the schedules for February and March. So once you scroll down past the current video available, it has, I think, milestones. I can't remember exactly what it says, but it does have a link to the training. Let me see if I can do this here. Let's see.
Thank you.
Sure.
Thank you.
When I go to the stars page, I get this page cannot be found, but it
Okay, I'm going to go ahead and share my screen and let's see. Make sure I share the correct screen. Okay, can everyone see the web page? So it's here
yes.
under Employers and Local Boards, STARS Pension Administration System. And then this is the screen that will appear. And here under STARS Milestones is the employer training schedule. And this will have the schedule for each of the different topics that we're going to have regarding the employer self-service area access in STARS. So we're starting out with the dashboard information, how to the administrative setup, and then we go into the demographics on week 2 and contributions on week 3 and work reports on week 4 of February. And then into March, we're going with payments, making payments in STARS, which is making payments to the contribution files, insurance processing, and then local boards. So this was a tentative, and we're but as we're getting closer and closer, this is getting more and more that the way we've got this training set up. So hopefully that's helpful for everyone to view and to plan for February and for March. And again, these trainings, live trainings, are really great to attend, but for each of these trainings, we will have video recordings available to review later if you need to.
Hi, Joanne. This is Ashley from the city of Tucson. I just have a question about the schedule. So I see like on Tuesday, Wednesday, they're the same events, different times. Is the training going to be the same, or should we plan on attending each session that's on the calendar?
No, we're providing multiple sessions with the same information to provide
Okay,
more access for employers to attend, depending upon their schedules. So exploring stars at 10 a.m. on Tuesday is the same presentation on Wednesday at 10 a.m. So we were trying to provide um, more for employers so that they could fit it in to scheduling.
thank you. I appreciate that.
Mhm.
Joanne, there's been a couple questions that have come through related to the training as well.
Okay.
First question that has come through has been, will there be a link or registration to sign up for these trainings? And are these trainings sessions an hour each?
They're going to at least be an hour each is what we're working towards, hour or less, depending upon the subject matter. We are still working out the details of the meeting regarding signing up or not signing up. We're still working on that piece of it. So we'll let you know as soon as we get more information regarding that, and we'll provide the because it'll be on Zoom. We'll provide the Zoom information as soon as we get that finalized for everybody.
Okay, there's another question on the go live date. Have we established the tentative go live date of STARS?
We do not have a specific date yet, but we will keep everybody posted regarding that. But right now, it is scheduled for April. So as far as an exact date, again, we're still working out that that detail regarding that information.
And just for some further clarity on that one, Joanne, the goal, excuse me, sorry. The goal is basically at the end of our March pension payroll run, which is roughly around the end of March, we'll say March 26th, March 27th. That is kind of our goal, our green light to begin our cutover exercises, which means, doing all of our cutover, doing our final testing, our smoke testing, everything around that, because the ultimate goal is we will begin April pension payroll within stars. So the goal really is like that first full week of April is when we plan to have go live. And when we say go live, that would also include the go live of employer self-service, meaning you'd be able to start processing your transactions, contributions, health insurance, new enrollments, etc., starting at that time.
Thank you. All right. Me, any other questions we can help with this afternoon?
I was just taking one last look, Joanne, at the chat, and I'm not seeing any new questions coming through.
Okay. All righty, everyone. Thank you for joining us today. Again, even before the February 18th employer check-in next month, we will begin training. So make sure that you do check that training calendar and get yourselves set for that. And thank you. And we will talk to you later. Have a great afternoon.